Hi, my name is Felicia Roach, and this week we're talking about the Challenge Yourself questions in Chapter 9. So the first question says, you are asked to attend a meeting of your organization's Healthcare Ethics Committee in which an ethical conflict that the organization is facing will be discussed. How will you prepare yourself for the meeting? Well, personally, I think if I was on this committee and I was going into a meeting, I would review the organization's code of ethics and kind of see where we stand on certain topics and what our goal of these ethics are. And then also probably do a little bit of research if I had an idea of what the issue is that they're facing, and hopefully in that aspect be able to provide some insight on what to do from there. So the second question is, the chapter explains that beneficence can have a negative implication, paternalism. What negative implications can other ethical principles have? So the other ethical principles, besides beneficence, include justice and autonomy, honesty. So as I was reading these, or this chapter, I was kind of looking at more specific examples, maybe not something so broad as paternalism, where clinicians kind of do what's right, but kind of taking on that fatherly role. So I thought that with these specific examples, kind of like the beginning of life and end of life decisions, kind of put these principles into perspective. So like for autonomy, for example, when we talk about something like abortion, we like to think that women are capable of making their own decisions and living their life. But what do we think about a fetus? I mean, is it a person? Is it not a person? Clearly it can't make decisions for itself. It can't fight for itself. So what do we do ethically? Like, is abortion a good decision? Is it not? And then two, we talk about end of life care with, if you have a patient with a traumatic brain injury, from a accident or whatever, or what if they're demented, what if they're old and they have Alzheimer's, what do you do? Who makes these decisions? Are they the best decisions? What if they don't have a power of attorney? Then who makes these decisions? What do we do? They clearly can't do anything for themselves. So I think those definitely play a role in autonomy. And then honesty and justice, I kind of go back to like the clinician point of view. So I work with physicians directly, and so I get to see this decision making process. I get to see them interact with patients and kind of like, where do we go from here? What do we do? When it comes to making health decisions, this CT scan is expensive, but I think you need it. They're not usually coercing patients into doing things that they don't want to do, things that they can't afford. They try their best to like work through it with them, maybe come up with other options. But I could see how that could be a problem, maybe not being so honest with them. We try to, people could try to trick patients into doing something that may not be affordable, that may not be the best plan of action for them specifically, So the third question says, healthcare ethicist William A. Nelson describes the following three situations involving decisions. Which of these decisions involve ethical conflicts? Pretend you are a patient safety officer. Okay, so the first one says that you need to choose among several software packages to track events involving patient safety. The decision is difficult to make, and you might need the assistance of a consultant to determine which software package is best technically and complies with organizational rules for return on investment, user friendliness, and compatibility with existing computer systems. So that one, I didn't think that there was really any ethical conflicts there. You're just trying to make a decision on what would be best. Hiring a consultant, fine. It's not like you're putting any patient information in danger. You're not violating any rules or regulations. Good to go. So the second one says you have decided to purchase an excellent software package. Unfortunately, it exceeds the budget approved by the finance department. You split the order for the software package among 3 purchase orders, thereby concealing its true cost and staying within your purchase authority amount and below finance's radar. So clearly, there's some ethical conflicts there. You spent way too much money. You're not being honest with how much you're spending, and you're trying to fly below the radar so nobody catches on to what you did. I mean, maybe it's for a good purpose. Maybe you really need the software, but again, if you don't have the budget, it's bad for the organization to spend too much money, because what if that money was going to something else? What if that money was going towards an assistant program for patients, who can't afford their medications? You have to think in those terms when in healthcare, I would assume. And then C says, to facilitate your evaluation of the vendor's software package, the vendor offers to take you to a site in Florida where the vendor's software package has been installed. The vendor will pay for your flight as well as your midweek 2-day stay at a hotel. You are tempted to take the offer because you are curious to see how the software works in real life. Besides, you rationalize, it has been a brutal winter and you could use a short vacation. So again, ethical conflicts. I'm not sure, I can't remember if it was in this class that we talked about, take vendors, kind of offering you things that maybe you shouldn't take, to get you to use their products. So clearly there's a big ethical issue there, because if you purchase this because they offered you something, that's a bad deal. Can't do it. So trying to rationalize this, if you have to rationalize it, it's probably not a good idea. It's probably unethical. I guess it would be cool if this is something that you're really interested in purchasing. Maybe so, but there's probably a better way to do it. Maybe watch an online tutorial or something. Maybe not take a trip to Florida. Okay, and then it says, clinicians' ethical obligations typically focus on promoting the best interests of their individual patients. Healthcare managers' obligations, however, often focus on the best interests of the patient population served by the organization. How could these different perspectives after discussions on ethical conflicts? Okay, so I think as clinicians, they focus just on the patient that they have at hand. What is going to work best for this particular patient? What can I do to help them? They need help. What do we do? Whereas healthcare managers are kind of like, okay, we have this great big group of patients who need help. What is the most effective way for our organization to help these patients? So for example, if a clinician has a patient who has this rare disease, who needs this super expensive medication, they aren't financially able to pay for this medication, you want to help, you want the organization to help pay for it, but the healthcare manager says, no, we can't do this. Of course, the clinician will be upset, the patient will be upset, there's an issue, because the clinician is focusing solely on that one patient, whereas the healthcare manager is thinking about the organization as a whole. Maybe that money could go towards other patients, more staffing, whatever the organization needs. The needs of the organization are maybe greater than the needs of this one particular patient. unfortunately, that's the way it is. That's the way it works. So that's it. All right. Thank you.